A third wave, fueled by variants of concern, represents a clear and present danger to Indigenous communities and could be devastating. As of today, in First Nations communities on reserve, we are aware of 1,174 active cases, bringing the total number of confirmed cases of COVID-19 to 23,514, there being 22,074 recoveries and tragically 266 deaths. I would like to point out that the number of active cases has been gradually decreasing over the past month. I believe that with the progress attributable to the vaccine, the tide is turning and better days do lie ahead, but we must remain vigilant to maintain this momentum. Vaccines are only one of the tools we have to fight the pandemic. To stop this pandemic, we must all use our prevention tools. Work continues with Indigenous communities and our provincial territorial partners to roll out vaccines. Overall, as of yesterday, over 200,000 doses have been administered in 586 First Nations, Inuit, and territorial communities. It is too early to speculate conclusively on the impact of the vaccine, but we know that respecting the protocol of the vaccine deployment, which is to get to those that are the most vulnerable, to prevent first and foremost mortality and then severe onset of symptoms and the consequences of sickness that comes from them, and then mass vaccination has resulted across Canada in the number of cases we see in long-term care settings. And I believe if you look at some of the data in Quebec, they were reporting for some time no deaths in long-term care facilities. We have early numbers that indicate that this is the case for Indigenous communities, but it is too early to draw a definite conclusion as to the impact of the first dose in most cases, but then obviously everyone is eager to see the impact and length of immunization of the second dose.